So my name is John Marshall. I'm a doc. I'm what's called a medical oncologist. That means I'm the chemo guy in the team taking care of patients with cancers, and I have a particular interest and focus on colorectal cancer. When I first signed up for this, colon cancer was an old person's disease, 60s, 70s, 80s. Over the last 10 years or so, we've seen a clear shift to where now almost half of my patients are under the age of 50. And we don't understand why. I saw a 17-year-old the other day in my clinic with stage 3 colon cancer. Colon cancer is a very common cancer, and we know that most of them occur from this benign precancerous polyp. And if you remove those polyps, you never end up then getting that cancer. We've seen the results of this. So patients who've been getting screened, people who've been getting screened, we're watching the mortality, people who die of the disease fall. We're watching the incidence, the number of patients getting the disease in the first place fall, because we're removing these premalignant cancers. So you don't want to end up in my office. It's not very fun there. And so the best way to stay out of it is through colon cancer screening.
I'm Julie Patel. I'm a physician assistant working with a gastroenterologist. I work with patients to diagnose, to treat, and also we work on preventative screening for patients. A colonoscopy is a very important tool for screening for colon cancer and detecting colon polyps and colon cancers. Most cancers actually form from polyps, so it's very important to detect these polyps and also remove them at the time of a colonoscopy.
I'm Dr. Tom Lockney. I'm the Director of Endoscopy at MedStar Georgetown University Hospital, and I'm a gastroenterologist. I perform colon cancer screening procedures, remove polyps, treat patients with existing colon cancers with colonic stents, and other procedures to evaluate their abdominal pain. One fear patients will tell me is that they're afraid that in having the colonoscopy we're going to find a colon cancer. And what I tell them in that case is if a colon cancer is present, we can find it early on a colonoscopy when it is far more curable, sometimes with just surgery alone, and very rarely with a colostomy.
My name is Michael Sapienza. I am the CEO of the Colon Cancer Alliance. I was brought into this field when my mom passed away from colon cancer, actually in 2009. It was Mother's Day. I founded an organization called the Chris for Life Colon Cancer Foundation. We actually then merged with the Colon Cancer Alliance, and hence now leading a national effort to fund research, to improve patient family support, and to help with prevention of this disease. What I often say personally is when my mom turned 50, if she would have had a colonoscopy, she would be alive today. So I think it's really important that you look at, whether it's your family member, whether it's your son or your daughter or your parents, et cetera, and talk to them about that and actually have a conversation about what this screening is. So in the 1980s, folks weren't really talking about breast cancer. They weren't talking about their mammograms. And now at Thanksgiving dinner, we're having a lot of conversations about that part of our bodies and making sure that every year women are going in at age 40 for their mammograms. I think that type of awareness and common language can help remove some of those barriers.
No woman would admit to not having a mammogram. She might choose not to do it, but she would lie and say she's done it, right? But it's amazing to me how many people I know who are smart, insured, know that they haven't done the test, asking, do I really have to do it? Yeah, you really have to do it.